and C. About 5% of hepatitis B virus carriers are also infected with hepatitis D. Hepatitis E virus causes hepatitis in the same manner as hepatitis A virus. The illness often very mild but may be life-threatening in pregnant women who suffer major failure of other organs in addition to the liver. It's very important to the pregnant woman. Hepatitis infection may come from routine dentistry. Thousands of people infected with the life-threatening hepatitis virus may have caught it during routine dental treatment. Although dentists sterilize their tool heads, there is a risk of infection from actual tool themselves, from the machinery that drives the tool. Blood could gather behind the drive mechanism of tool, which could lead to transmission of this hepatitis. There is an effective submit vaccination that protects against hepatitis B. So on the vaccination only against hepatitis B, no vaccination against CD. This is my city. This is mosque of Khalid ibn al-Walid, Saifullah al-Maslum. That is why people from Homs know how to fight very well. Now I'll talk about vaccination. A full course of hepatitis B immunization consists of 3 injections. The second dose 1 month after the first one, and the third 6 months after the initial one. So we should put the date: first one, second one, and the third one 6 months. All 3 injections are needed for maximum protection, and antibody response should be checked 3 to 6 months after the final injection. If sufficient antibody titer has not been achieved, a 4th injection of hepatitis B vaccine may sometimes be necessary. All those immunized should be re-immunized at 3 to 5 year intervals, depending on degree of initial antibody response. Who should be immunized? Workers in healthcare field, يعني نحن. After a sharp injury, if serology indicated a low level of antibody. So if somebody have wound, we should go to make blood test checking antibody of hepatitis. After regular testing indicated warning antibody levels. Clinical dental students and staff in many developed countries are now vaccinated. Infection control. In order for there to be no risk of infection, dentists would have to have 2 or 3 spare sets of tools in order to ensure all equipment was sterilized properly. A number of studies have shown that only heat is effective at killing. Only heat are effective of killing the virus. That means autoclave must be used. Chemical cleaning agents are not effective when used alone. Where possible, disposable units should be used. This includes sterile cartridge, local anesthesia, and needle, scalpel blade, and discs, and for cutting tooth material, dental beers and brushes, and metal bands that are used help for matrix to place restoration, which can cut into the gum, causing bleed. A permanent hand piece should be covered with baggie, that plastic baggie we are using, alhamdulillah. The baggie will catch the blood splattered by a high-speed drill and then can be removed and properly disposed of. The blood can contain, this is very important, contain with lubricant and be very difficult to remove otherwise. Doctor and assistants should wear face masks, gloves, eye shield, and gowns. Disinfected of dental unit is recommended after finishing the treatment. Sodium hypochlorite is the best of the chemical disinfectant. Impression should be disinfected. Very important. Extracted teeth used in dental education setting should also be disinfected. يعني إذا بدنا نعطي الطلاب أسنان مقلوعة بدنا نعمل لهم نحطهم بالdisinfected material. خلي لكم إياها. Dental health care worker should be concerned primarily with hepatitis B, C, and D, as occupational exposure to this pathogenic places them at risk of developing acute or chronic infections. Dentists and their staff should know well the risk of infection from patients, the risk of cross-infection between patients, يعني ننقل من مريض لمريض, and the risk of infections each other. يعني نحن دكتور بيعدم الاسيستنت او العكس. Rigorous and routine implementation of universal infection control measures can prevent transmission of virus in dental setting. A vaccination is currently available for hepatitis A, B, and D. It's likely that the future of vaccination for hepatitis C would further potentiate these protective measures available for dental health care workers. Thank you.